Hello everyone, this is Lisa Johnson from Everbridge. Welcome to today's webinar, Using Social Media Wisely During an Emergency with Janet Kennedy from Get Social Health. I am your moderator, Lisa Johnson, and I've been with Everbridge for 2 years now. I've been in the healthcare field for 4 altogether. That little map to the side is just an indication. Perhaps I had the chance to meet you sometime during the year, maybe at HIMSS or the American Telemedicine Association. And we will be at several, I have to update the slide. We will be at several conferences in the fall, including ACEP, which is the American Conference of Emergency Physicians. We'll also be at the National Healthcare Coalition Conference, and we'll be at the California Hospital Association Conference this fall. So come on by and say hello. I would love to meet you in person. And then, of course, you can't have a social media webinar without mentioning at least your Twitter handle. So we are on LinkedIn, Facebook, and Twitter. You can follow healthcare-specific information at EB Healthcare. Okay, I'd like to introduce our speaker now, Janet.
Oh, and I get to say something now? I get to introduce myself?
Yes. Either one. Would you like to go?
Well, actually, now that I'm here, I might as well speak up. Hi, everybody. My name is Janet Kennedy. My CMD stands for Certified Marketing Director. And actually, my whole career has been in marketing, and I'm a social media early adopter. I have been a social media consultant for a number of years, and indeed started the Get Social Health podcast so that I could learn more about what's going on in marketing, social media, and healthcare. Just this past year, I launched something called the Healthcare Marketing Network, which is a global community of freelance writers, authors, and communications creatives to assist hospitals and healthcare practices creating additional content to supplement the work that they're doing. And I'm also very proud to be a member of the External Advisory Board for the Mayo Clinic Social Media Network. Today's program was a challenge for me because I got to actually interview a lot of different individuals about what they're doing in this arena of social media during a crisis situation. And one of the things that I'm really, really proud of in our community is that healthcare marketers and social media people are always very willing to share their best practices and their stories. And unfortunately, we've had a number of critical crisis events that have involved social media, and everyone was extremely helpful in sharing their stories and their ideas. So here's what we're going to be talking about today. First off, I know that a lot of you are managing social media or engaged with social media at your organization, but you may not be the person with the hands on the wheel. So I did want to give you a kind of a big picture of what's going on in social media and healthcare. I have some very specific examples of crisis situations and how social media played in both good and bad, and we're going to talk about how social media impacts a crisis situation. And then we're going to talk about how you can optimize your team for success and the kind of things that you need to do to prepare for having a very proactive, positive social media presence during a crisis, and the importance of building your community in order to do that. Lisa, let's get everything started and kind of figure out where we are, and why don't we ask a poll question?
Yes, hello, and this poll is just specifically designed to see how you're already using social media now. In general, by the way, we get over 80% participation on our polls, so we would love it if you would contribute. It will help us, it will help guide us through today's session so that we're giving you the most accurate information that we can. So Janet, I have a quick question for you. How often should a healthcare facility use social media?
Well, I believe firmly, and of course, I'm the evangelist for social media, but you should be active in social media every single day. Even if your presence is minimal, you should be monitoring what people are saying about you. So somebody needs to have their hands on the wheel.
I have to say I agree 100%, and our audience is pretty strongly in favor as well.
And this question, of course, may not necessarily be related to you personally, but your facility as a whole. So we're trying to get to the big picture view of the use of social media.
47% responded daily, 26% a few times a week, 12% a few times a month, 11% have accounts but they're not active, and only 5% do not engage in social media at all. So that's pretty fantastic.
Excellent. Well, you 5%ers, reach out to me and we'll see what we can do to get you started in social media. All right, well, let's get a big picture here. And again, it's very obvious that I'm sort of singing to the choir, and for the most part, you all know and appreciate social media, whether you feel it's the monkey on your back or whether you really are enjoying engaging with your patients and your community. The bottom line is social media is everywhere. And I will tell you that I've been teaching these webinars for a few years now, and not that many years ago, I still felt like I was explaining why social media is important to a healthcare community and to a healthcare facility. Now it's really a 360 reversal of that, and it's why aren't you in social media? Because we know that every demographic is present and growing, that not necessarily every platform appeals to every demographic, but that people are in social in some way or another. I mean, how many of you are being held hostage by your grandkids and you can't see the pictures of your grandkids or great-grandkids unless you join Facebook? And I think that's why we've seen so much growth in Facebook among the over 60 population. The bottom line is everyone is in social media in some way. And even if they aren't, they may be piggybacking on someone else in the family. So social media is everywhere. The flip side of that is, and this is where employee training we'll discuss in a little bit is important, is that there's no such thing as private social media. Even things like Snapchat that are supposed to disappear in 24 hours, that's not really the case. It only takes a second to grab a screenshot and to have it shared. So if you think you are sharing something privately with your family or friends or even an individual, it only takes one screenshot to be shared to kind of blow that out of the water. So number one, social media is everywhere. And number two, always follow grandma's advices. If you didn't want it to appear on the front page of the New York Times, don't say it in social media. Patients have been really demanding social media as an avenue of communication, and this has dramatically changed in literally just the last 5 years. We know, for instance, that 86% of patients conduct a health-related search before scheduling their doctor's appointment, and they actually take the questions and the information they learned into the physician's office with them. One of the things I talk to my physician clients about when they get a little frustrated about that is, if you don't want your patient searching online to find out answers to sites that you don't approve of, then tell them where they should do it. So if you're not providing the content on your own, in your practice, in your hospital, if you're not providing that information, you should have vetted sources that you feel you can support and tell them where they should be looking, as opposed to just broad Google searches and who knows what they're coming up with. We also know that, for instance, on diabetes information, as much as 80% of the information online is inaccurate or even flat out wrong. Now, you can multiply that by any number of other illnesses or chronic health situations, and there's a real challenge with information not being accurate. So here's my impassioned call out. You need to be part of the solution, and you need to be providing content about the health issues that are important to your patients. We know patients also are treating healthcare providers, hospitals, and organizations as the same way that they might treat a restaurant or a car dealer, in that they are going online to search for your reputation, for reviews, and for information about experiences with your organization. So whether you think it's appropriate or not, or whether you like it or not, unfortunately, you don't have much of a say in that. So you need to be cognizant of what's happening and make sure that you are tracking information and comments about you online, because people are talking about you. On our younger demographic side, we know that obviously they are digital natives and they are totally hooked into social media. They also are very trusting, which is a little bit surprising because you think they'd be the jaded, cynical generation. However, they have said as many as 90% of them would trust medical information that they found online through their social platforms. But that also means they're asking their friends and relatives for information, so that we have all become purveyors of health information, whether, again, it's accurate or not. The upside is, of course, that people will use it to take action. So it's nice to know that at least half of the people who are searching for health information online, that will trigger them to make an appointment. One of the other things that I also coach about is making sure that you are socially savvy on mobile optimization. And that's because this number's already grown. We're over 70% of Americans owning a smartphone. And that we know that more than half, almost 2/3 of them, have searched for health information online. Of course, there's those young millennials, the 18 to 29-year-olds. They have all, 9 out of 10 of them access information through social networks, and they get their health information there. And that 10% of smartphone owners only access the internet with their smartphone, that they literally don't have a desktop or laptop at home, and that they're using their phone to do their internet searching. Therefore, the onus is on you as healthcare providers to have a website that is mobily friendly, that is easy to access information. There are a number of great websites that you can go to test out your website, and if you need to know those later, feel free to reach out to me. I'll send you those links. But it's critical that you have your website be able to show properly in mobile. Oh, hey, we got another question.
Hello, Lisa again, and we don't have a lot of questions today. This is our second one and our last one. So we did talk about your hospital or facility using social media in general, but how about specifically during a crisis? So have you used social media during a crisis? Yes, for a minor incident such as a low impact storm, maybe some construction work happening at your facility. Yes, a significant incident, for instance, Hurricane Matthew last year, social media was used extensively by law enforcement. Or no, we've never used social media for an incident. I am very curious about what the numbers are going to be here.
So am I, actually, because it's going to trigger in which slides I pause on and which slides I fly through. So you'll actually have an interactive opportunity to direct some of the content here in just a moment.
Here we go. And the results. So let me read them out. So have you used social media during a crisis at your facility? 22% have used it for a minor incident, 30% have used it for a significant incident, and 48% have not used it during an incident at all.
All right, that's fascinating. I guess we would like to say that congratulations on the 48% that you've never had an issue pop up. However, it's only a matter of time, and I'm not trying to be a Debbie Downer here. It isn't necessarily just related to some of the dramatic things we're going to be talking about. It's as simple as weather conditions or electrical outages. People will be looking to social media to find out information. So let's talk a little bit about social media and healthcare, and why it's really important to be active in social and using it to prepare for the time when you might need it for crisis communications. Number one is patients. They're in social media and they're using it to find people with like experiences. That means that if somebody's having a health issue, let's say, for instance, your crisis happens to be related to mumps or Zika virus, they're going to be looking for other people who are talking about that health condition. The same goes for medical professionals. They may not be doing it as public a forum as social media, but sites like Doximity are also, and Sermo are also considered social networks, whether they're closed or open, and they're using social networks in order to connect with individuals. Obviously, in a crisis situation, this is the most important reason why you need to be active in social, and that's because that's how people are sharing information and updates, whether it's texting, online communities, Facebook, all these immediate ways to communicate have become essential as parts of dealing with a crisis situation. One of the great benefits of social media, which to some can also be a downside, but one of the great benefits is that you can now reach literally everyone in your community who is connected via the internet or to social networks. In other words, while you may only have 1,000 followers on your Twitter handle in any given day, if you are having a crisis of any kind, all kinds of people can pop in, see what you're saying, and get the information. So unlike traditional media, where if I need to grab a newspaper, which wouldn't help me because it'd be outdated, or even tuning to radio stations would be very hard to figure out where to get accurate information, through social, you can get directly to the individuals who need to know what you want to share with them. A real benefit to having an active blog, or an ability for you to have content that's a little bit longer than your 140 characters in Twitter, is that you can tweet out, here's our response to this situation, here's more information about the parking deck, here's some more information about the Zika virus, and you can have a link in your fast social media, your texting, and direct them to a web page, so that you can have more information ready to go at a moment's notice. Just be able to tweet that link out, so you can get to the detailed kind of content that you need in order to keep people up to date with what's happening. There's nothing like, unfortunately, a crisis situation to pull people together. So knowing that you are active in social and that people will be following you and tagging your content during the course of a social event, that also means hopefully that you will maintain that relationship with them after the event. I'm not trying to say we need a crisis event to grow our Twitter profile, but that is an upside to it. And knowing that you grew people for that reason, be aware of the kind of content post-crisis that you are sharing, because you probably would have just gained a potential large number of new followers. And I think most importantly, it's about establishing yourself as a leader in your community. Healthcare organizations, and especially hospitals, are considered part of the backbone infrastructure of a local community. And if you're not taking that role forward and being proactive about the information you're sharing and the ability to set up a good communications network, I think you're really missing an opportunity to serve. And we know that that's, for the most part, the major mission of all our hospitals and healthcare organizations. So this isn't something where you want to be able to communicate to people a few times a year when some emergency has occurred. You need to be a voice in the community and speak for your community on a regular basis. So let's talk a little bit about 3 different kinds of healthcare crises that could happen, that where social media will play a role. One, of course, is environmental, and as you already heard us mention, it could be hurricanes, tsunamis, earthquakes, could be any number of ice storms, snowstorms, things of that sort during the course of the year. You know this is going to happen. Every community has some unique weather situation. Could be tornadoes in the Midwest. For us, it's hurricanes on the East Coast. Knowing that you're going to need to share information, even if you are not impacted physically by it, but you want to share some important information regarding the care of individuals during the course of an event, it's going to happen. Nobody lives in a perfect environment, so be ready for that. Medical issues are the things that can sometimes happen very, very quickly, such as, maybe an outbreak of E. coli after a state fair, or it could be something where you know it's going to happen every year, mumps, measles, flu season, etc. So some you can prepare for, some you prepare the groundwork so that should you have a medical emergency, you're prepared to deal with it. And of course, unfortunately, the ones that tend to impact us in a huge degree are those that are human triggered, whether they're anthrax related or live shooter situations. Those are the ones that you can prepare for and you should practice for, but you have no indication of when it might happen, and you literally need to be ready at a moment's notice. So let's talk about weather emergencies, because honestly, this is the one that you're going to be dealing with most frequently, and is indeed a way for you to get practice when you're getting into a larger crisis situation. So in North Carolina, I will say we fall apart when you talk about rain, let alone ice storms. And we will have something that I know our colleagues to the north might poo-poo, but we will have our community shut down if ice appears. And that's because we don't have the equipment to care for it. And, you know, we might be able to clear our major highways, but driveways will stop people from moving around. We did have a situation not that long ago where we did actually have to close some medical facilities. Therefore, Twitter became an extremely important technique or communications avenue to tell people what was happening. So knowing who is on the driver's seat and are they getting the information that they need to share is really important. It's also important that your people be not just pushing content out, but be prepared to respond. And it isn't just to patients, it could be to employees as well. Who should be coming to work in a certain situation? Who is giving the right information to the right people? And make sure that whoever's handling the social media has the information that they need to accurately share what's going on. Those of you who followed the Ebola crisis, this was one obviously from, you can't even give it a statistical impact, the number of patients that we dealt with in the United States of America, but you certainly can look at the impact of the fear and the concern that was happening. As it turned out, we did actually have a physician who came back who was treated in North Carolina, I will say about 5 hours from where I live, and everyone in my community was asking about it. So there was a lot of fear and a lot of misinformation. Ebola is an extremely scary sounding disease. What we know about it as private citizens is very, very concerning. And if there was any potential that something like that could happen, people were totally overreacting. And that's because we needed really good communications network. What I want to show you are a couple of charts here from a website called Sympler, S-Y-M-P-L-U-R. They are a website that tracks healthcare related hashtags. And if you haven't heard of them, you should be logging in as soon as this is over and tagging that website. You can search hashtags for activity, whether it's conferences, healthcare, tweet chats, or even emergency situations. So the chart on the left actually shows geographically what was happening. So we know that for weeks there were conversations about what's happening in Ebola or in Africa related to Ebola. And then suddenly you can see the peak. Someone showed up in the United States presenting with Ebola, and wow, Twitter went insane. On the other hand, the second chart is where the CDC actually said, okay, let's talk about this. And they had an organized tweet chat where they had medical professionals there to answer questions and to present information. And it was an overwhelming response of individuals who were there participating in this Twitter chat. So Twitter is really a phenomenal way to get information out quickly, to connect with people, and to answer questions. And I hope it is a big part of what you're doing in your healthcare social media. SYMPLUR is the site you want to check out. Now, this is the kind of thing that you're much more likely to run across. And unfortunately, because of some of the anti-vaxxer philosophies, we're going to see more and more challenges where diseases and illnesses that we thought were gone and eradicated from this planet may potentially be coming back and be a serious issue that we have to deal with. And this goes back to my impassioned plea to make sure you are providing accurate information. In this particular case, we saw an issue with mumps happening up in the Minnesota area, and many of the hospitals up there had to have very proactive programs in order to share with people what is going on with mumps, what it's all about, how to teach and train, and to share the importance of getting vaccinated. And we saw this happening in a couple of different hospitals, did a really nice job of sharing information and literally using, in this case, Facebook, among other platforms, to give almost hourly updates. They were giving regular updates about what was happening with this mumps outbreak. One of the organizations, the Grand Ronde Hospital, shared their data with me, and this is something really interesting when you look at this. They actually did some organic posting, but they also did a paid campaign to make sure that they were reaching people, and they reached almost 10,000 with this campaign, of which 1,400 actually clicked through to information. And I don't know if you've ever been exposed to Facebook ads. Well, of course you have. One of the things that you can actually respond to is you can say, oh no, I'm not interested in that. So it's interesting that almost 10,000 people saw this ad and only 2 people chose to hide it, which is an extremely low number. A lot of different responses from individuals and a lot of shares. So another thing to think about, as much as you may not like the idea of a pay-to-play environment, if you do want to get your health information out, you need to be able to reach people who aren't necessarily seeking that information, but it should be in front of them. And I'm thinking, for instance, of an E. coli outbreak, for instance, maybe after a state fair has been in town, you might consider having money set aside to do a paid ad campaign to share health information for your community. Of course, first shooter situations and dramatic life-threatening events are something we dread. Unfortunately, are also becoming something we are having to deal with on a more frequent basis. This was an interesting situation. The London Bridge attack, which was recently held, was someone who had pulled a van over and was stabbing people on London Bridge. The hospitals that were involved all are related to each other, and what they had was one hospital taking the lead and doing the primary identification of what was happening, sharing the communications with the community, and then the other hospitals were retweeting that information. So they really had a very concerted approach to how they were sharing the information, and they were doing it in a very cooperative way among the other hospitals' audiences. Their tone, very British, of course, but it was very careful, very calm. They provided additional information to let people know where they could find out more things, what phone numbers they needed to know. So they, in a very short period of time, had a very, very effective response to this particular crisis situation. I think the Pulse nightclub is one that you couldn't really have a program like this without addressing, and I have a few slides on this. It was obviously a horrific situation. In the case of Orlando, there were, I guess the upside is that the hospital was practically within walking distance. They were very, very close to the scene of the incident, and their team had actually practiced their emergency program before. They were well versed. As a matter of fact, some of the individuals, physicians who were in charge, came back after the event to write about what was happening that day, and they said they came to the emergency department prepared to direct people, and they didn't have to do that at all. Everyone knew exactly what they needed to do. And from a social media standpoint, they were very careful about the information that they were sharing. They made sure that they were really addressing the needs and the questions that came up. They obviously immediately addressed the issue of facility access and lockdown issues if you're bringing patients in, where to bring them. They also reinforced the capabilities and the experience of their team. It wasn't a look at us, it was to reassure that they had trauma-level surgeons there and available to help. Again, had a lot of resources to share about where patients could find additional information, and as much as they could, they provided patient status information. The Boston Marathon bombing is a very similar situation, and also very interesting in that they knew in the hospitals, of which 6 or 7 in the Boston area all took between 18 and 35 patients, also very close to the event. They had a few benefits going on with being able to respond quickly. Number one, of course, it was the marathon, so that there were EMS at the finish line. A lot of individuals there to help triage right on the site. Secondly, one of the physicians at one of the hospitals, one of the surgeons, was actually following along the marathon because a friend of his texted out. So they knew within 60 seconds of the bombing that something big and dramatic was happening. Therefore, they started the communication process. They were fortunate in that this also happened at a shift change. So all the first shift stayed on, and the second shift came in early, and so they had double the number of individuals who were available to help, which also made lessened as much as possible some of the dramatic information. But social media was key to getting the word out and sharing information. And as we know, of course, because you had both the medical emergency and then the manhunt that happened after, social media played a big role in that. And even the police department was actually counseling via their Twitter handle what individuals should and shouldn't do. For instance, they publicly asked, please don't share images or video of where our SWAT teams are, because we are now searching and we don't want the individuals that we're looking for to figure out where we are. They actually had to counsel some folks. And that's going to be something we're going to talk about a little bit in a little bit, but this is an issue that one of the Everbridge's recent speakers, who's done a number of programs for them, his name is Steve Kermondo, and he is an expert in responding to crisis situations. We had an interesting conversation about something that's termed hyper-accelerated epidemic hysteria. And this is where social media, really the ugly side of it, comes to play, is that we have the ability to share information very, very quickly about what's happening, including in some cases what the symptoms are to a particular illness or medical crisis that's happening. And what we are starting to see is the acceleration through the amplification of social media in people responding to a medical situation, actually thinking that they might potentially be exposed or have this issue. For instance, in the 1995 Tokyo subway sarin gas attack, that produced a 4-to-1 ratio of psychological casualties to medical casualties. In other words, for every one person who might actually have been exposed, 4 people thought they were exposed. Whereas there was a radiation accident in Brazil that had a 500-to-1 ratio. In other words, for every one person who potentially was exposed to this radiation, 500 people presented with active symptoms related to radiation exposure, which couldn't possibly have been exposed to this situation. And this is not a question of them just thinking, oh, I was near this area. They actually were showing MUPS, medically unexplained physical symptoms. So they were people who knew enough about what was happening via social media, and it accelerated to a point where they literally had physical symptoms, which would hugely tie up the emergency departments. So regardless of whether there are actual casualties in the number you have, the potential in a medical crisis is such that you could have double, triple, quadruple, or times 500 the number of people seeking care who aren't necessarily presenting but do have issues. So it becomes even more critical to make sure that your teams are well prepared to both serve that potential patient population, but also address the information related to it. We unfortunately also have issues where even small communities are impacted physically by hoaxes in social media, and this is the really quite the ugly side. There was a Facebook threat that forced the lockdown of a hospital, and it didn't actually have any kind of actual implication. Nothing actually happened. It was a threat, but it did cause the shutdown of the hospital. It was a threat that was made in Facebook. And while the hospital only has 15 beds, it is as dramatic an event for them as it would be for somebody in a larger healthcare situation if that is the local hospital that is being served. On that same tone, there was also another issue of people sharing the thought that there had been a mass shooting and a hospital lockdown. And again, nothing like that actually happened. They were false reports, but everyone got very afraid, very scared, and responded because of what they had read in social media. So your social team, while the first inclination may be, nope, we don't see anything going on here, that doesn't mean that the individuals in the community aren't panicking, and you need to be prepared to address those concerns. So how are you going to go about doing that? Well, number one is, do you have a plan? Do you know what you're going to be doing? And I know most of you represent individuals who are involved in emergency preparedness response, but is social media part of your plan? Recently, a company that specializes in this did a survey of 75 companies, not all necessarily healthcare, but a wide variety, and were shocked to find out that almost half of them had never actually practiced their crisis response plan, and that only 18% believe that they'd be able to have an approved statement ready to go within the first 30 minutes. Well, the whole Pulse shooting happened in the course of 4 hours, and they had their first public press conference at 9:30 the next morning. So 30 minutes is an eon in social media time. And that fewer than 30% thought that they would be prepared to respond within 15 minutes. That speaks to a couple of issues. Number one is being able to respond and have a statement to share. But number two is, who's got their hands on the wheel? Are they skilled, and are they prepared to be able to respond to a situation like this? So I usually talk about a social media policy with my clients as it regards to just everyday usage, making sure that both employees and healthcare providers are aware of the importance of HIPAA and privacy laws. And it has much more to do with just the general everyday use of social media. Therefore, I always encourage every one of my clients, and every actually healthcare organization in the country should have a social media policy. It should be in writing. And we know, unfortunately, that we're not at 100% as far as healthcare organizations having a social media policy. And obviously the reason is because social media is everywhere. And if you don't have a policy, it's very hard for everyone to understand what the basic rules are, because everyone's interpretation of social media could be different. You could have, and there are documented cases of, say, temporary workers who feel that, oh, well, I can share this on my private Facebook page because I don't have that many friends and it's going to be private, and don't understand the ramifications of social media in a broader sense. So set your people up to win, not to fail, by having both a policy and training to support that policy. It will, of course, end up protecting your reputation, and that if you do end up with a situation where an employee is improperly using patient information, and a crisis situation is one where that very definitely could play a part, you have enforceable responses to those situations. So I want to talk a little bit about crafting a policy, who needs to be a part of it and why. Number one, of course, it should drive out of the marketing and communications group, because they're going to be the ones that are handling the social media handles. They should make sure that they have examples and ideas of what they'd like to see in this policy. They should have the ability to do branding management and have very clear and concise language for all levels. For instance, the Mayo Clinic has a social media policy that is written for their healthcare employees. They also have a policy that is a deeper policy for their social media team, and they also have a policy that they publicly post for patients. So patients know and understand what is and isn't appropriate from the standpoint of the use of social media in their hospital environment. Of course, compliance needs to be a part of this conversation, because that is in essence the role of the social media policy, is to make sure that you are in compliant with laws and HIPAA regulations, but certainly would come into play during the course of a crisis situation. And then legal needs to be a part from a risk analysis standpoint, and really they need to look at it from two perspectives. As I mentioned, the everyday concerns of social media, and then again, what's the ramp up, what's the change in the case of a crisis situation. Your executives have to be a part of this, and you need to make sure you drag them to the table, because they have to commit to the idea of social media and supporting social media, because it is the voice that your patients and your community are going to hear, and they need to be on board with that. Of course, human resources needs to be involved, because should there be any issues related to the use of social media, they're the ones that have to deal with the ramifications of that, and they probably will have some very insightful commentary about how to word things. Also, a social media policy is not an independent piece of content. It should be part of your ongoing manual. So if you already have, as part of your employee guidelines, a professionalism clause, then the social media policy doesn't supersede it or isn't an addition to. It should refer back to the existing employee manual. And then it's also important to have attending people who are actually going to be held feet to the fire with the use of social media. So whether it's nurses, volunteers, staff members, they should definitely be a part of helping create and craft this social media policy. One of the things that is often not clarified is the escalation process. So what happens? At what point does the person who's normally using and managing your social media, do they need to call in for help? For instance, in the normal situation, it would be because patients who are maybe releasing HIPAA information, and you might have some standard responses for, we'd love to talk to you about your situation, please contact us here, let's take this conversation offline. But in the case of a crisis situation, this may be the time where your CMO steps in and either guides or is actually handling the responses themselves. So know at what point do you call in the help, and who's going to take the reins, and do they even have access to the platforms that they need to have access to. Just as an aside, there were questions during the course of the shooting in Orlando where the hospital actually publicly sought a pass on HIPAA, because so many people were asking about patients, and in some cases some family members weren't even part of those individuals' lives. It was their friends and basically their community who needed to know. So they actually publicly asked for a buy on the HIPAA regulations for that brief period of time. However, in the course of analyzing this, probably wasn't necessary that they did that, but that just shows you the importance of how seriously we are all taking HIPAA. Training is critical to making sure that your social media execution during the course of a crisis is effective. And if you don't train your people, and as you have turnover, train new people and make it part annually of your employee reviews, you're really going to lose an opportunity to get people working for you and not against you. So be very clear and have examples of what is or isn't appropriate language. Explain the escalation process. Make sure that you have language that says, in the event of a weather, medical, individual crisis, here's what's going to happen and what we do and don't want you to say. Be very encouraging about it, because you may want your employees all sharing information about where to get a mumps vaccination, why it's important. On the other hand, you may not want your employees tweeting out pictures from the emergency department saying, hey, we're handling this really well, everybody's, in good spirits, whatever it is that they might be tempted to say. So make sure that you have a written playbook. For instance, there was a situation where one of the employees at a hospital in Orlando was actually sharing via Facebook some of the information, and that could have been very problematic. So every employee, all the way to your custodial staff and your temporary workers and volunteers, need to be trained on what's appropriate to say and do. Everyone wants to be helpful, but you don't want them to err on the side of making a mistake. Make sure you're telling people if there are any changes or updates to the policy. And it's a lot easier to show, say, here's an example of something that we don't want to have happen. I recently did a training program for a hospital who had seen another hospital in the area have a situation regarding a employee, a nurse, who during the course of the election, when fevers and interests were very high, made some derogatory comments in Facebook that were then shared publicly. They were unfortunately racist in nature, and it created a huge firestorm in the community. And the response was that in 24 hours, this person wasn't employed anymore, but it actually did cause quite a bit of concern and heartache. So think that your crisis may not be a result of a first suitor situation. It could be something that is self-induced by individuals not really using good judgment in how they use social media. And there's no way, no matter what you tell people about, don't identify yourself as an employee of, it's pretty hard to keep that a secret, and it's pretty easy for people to figure that out. So it could end up being a self-induced crisis. However, be encouraging. If you scare people away from social media, you're not also creating an environment where they could be helpful to you. So also train and do it frequently. So in executing your communications plan, number one, obviously have a plan and then practice it. And there are actually groups that will come in and set up a limited area Wi-Fi signal. So you actually could fake tweet out an emergency only in the scope of your boardroom and have people practicing responses. That's a really cool way to go about testing, well, how would you say and what would you say? Because unless you are the one on the keyboard at the moment that that happens, you never quite know how you're going to respond and how some people would take the way you might write something. So define what your crisis is. And of course, there's, as we mentioned, any number of them. They could be environmental in nature. They could be based on weather. They could be based on medical issues. They could be based on an internal issue. Make sure you've assigned people so they know what their role is and who's going to say what. For instance, if you feel like your crisis is something that's going to get regional or national attention and not just local, who's the next person that should be speaking? Is it your normal PR person, or is there somebody at another level who needs to be sharing that information? Definitely have a checklist before it happens. What do you need to have in place? Do you have all those resources, all those phone numbers, all those kinds of information available on suicide hotlines, PTSDs, where people should go for additional information? Have that ready before you go. And then, of course, once it's over, before everything gets too far down the path, sit down and have the conversation about what you could do and make it better for the next time. So best practices for managing this crisis communication situation is, number one, have a playbook. This should be digital, and it also should be printed, because if your crisis is that your internet is down or you're on emergency backup power, for instance, in North Carolina, we've lost access to Ocracoke and Hatteras Islands because a huge power cord was cut down, and there are healthcare organizations out there. Well, what are they doing? They've got to have other ways to communicate. So have that hard copy as well as the digital copy. Practice it. Go through the process of having a test of the plan to make sure that it works. Ensure that you're trying to communicate on more than one level. So use Facebook, use Twitter, use your local media. Figure out how are your patients in your community seeking information from you, and make sure you are addressing the channels that they want to use to get information. Responding quickly is very important, but not quite as important as responding accurately. And we've definitely seen in crisis situations where people have been asked to step back. That's not accurate information. We're going to give you updates. But if there is a void, people will fill it. And then, of course, review, revise, and update after whatever event. So you remember I mentioned this hyper-accelerated epidemic hysteria. It is a double-edged sword in healthcare emergencies, Steve Cremando would say. And that is because as much as you need social media to get that information out there, what's going to happen is you're going to have individuals sharing that information back, or the information that they think is important and relevant from their perspective. So misinformation is something you need to be prepared to address. Don't go into a crisis situation thinking that this is a one-direction source of information, that you are only putting out information, because you need to be watching what people are saying, listening to what people are saying, and be able to respond. If there are inaccuracies, if people, whether it's purposefully or with a good heart but a not complete knowledge of the situation, are sharing incorrect information, you need to be prepared to respond to that and to have the information that people really need to have in a very quick pace. We know that a lot of organizations are just winging it. They're just hoping that they've got their plan together enough that if something pops up, they'll be ready to deal with it. But social media and digital platforms change the nature of events in the stroke of a keystroke. And you can't turn your back on the ability of citizen journalists to really either manipulate or make it more difficult for you to manage your own crisis situation. New media like the internet, emails, blogs, text messaging, cell phone photos, we know that it has an incredible ability to change the world. We've certainly seen that in the Mideast and in Eastern Europe. There are ways for social media to be used in very positive ways, but there are ways that it can be used that heighten the situation and cause more problems. So you need to be knowing that you're going to be managing citizen journalists and information not just from traditional print or electronic media. So I advise you to get on your social programs now. A few years ago, we had, within a 6-week period, 3 different hospitals have an active shooter situation. And I grabbed a couple of screenshots at the time. And one of the things that I would like to share with you today is that if you are not active in the conversation now, then the crisis is not the time to start that. We have a situation here where Renown Medical Center had a live shooter situation, and Children's Hospital did as well within a short period of time. Children's Hospital was able to manage the messaging, to send it out, to be on top of what's going on. They were even at a point saying where doors were locked and where people should and shouldn't be in their own hospital. They were actively managing the situation. Whereas Renown did not have a Twitter profile at that time. Therefore, all their messaging was conveyed by other organizations. Could have been individuals, could have been the police departments or the EMS, but they did not have control of their own story. So you need to be in social so that when something happens, you are ready to manage it. And last but not least, unfortunately, the nature of some of these issues are so large that you do need to have resources available that are bigger than your own healthcare organization. The Google Person Finder was enacted during the Boston Marathon explosions. You've probably had a Facebook check-in pop up that one of your friends has checked in that they're safe after a natural disaster or an unfortunate situation. I saw that happen with a friend who I didn't even know was in France at the time that there was a bombing in France. So make sure you have these tools available so that you can share them with your patients in your community. So I'd like to thank you very much for participating in today's event. Again, my name's Janet Kennedy, and I'm the co-founder of the Healthcare Marketing Network. And we have marketing, social media content, social media trainers, and webinar delivery folks, all a part of our network. We've got several hundred writers and communicators available. So if you need any content or if you need any marketing advice, I'd be more than happy to help you. So now we have time for questions. And if you would like to contact me, my information is here.
Thank you so much, Janet. It was great for you to be here today and to share that information with us. There are so many actionable items that we can take away. I really appreciate the time that you took to put this presentation together. I did want to talk to the audience briefly about how Everbridge can connect you to social media. We are, after all, a communication platform, but you might not know how our communication platform can interact with social media. So one of the big advantages is that you can post to social media from our platform, so you don't need to be hopping off and on, going to different software programs. You can just manage everything from your desktop. You can also send the same message, if it's applicable, to multiple platforms with just a few extra clicks. You literally just click Twitter, Facebook, LinkedIn, whatever it is that you want to send it to, and it will go automatically. Because you are launching the posts from inside our communication platform, they are automatically tracked. And that is something that you need to think about for CMS reporting. Communications is very important with the CMS emergency preparedness guidelines, and this will help you anytime a regulator comes in or a surveyor comes in and they want to see what you did during an incident. You'll have the report right there. You won't have to go and collect it from social media sources. And then probably the most powerful tool that we have as part of the Everbridge platform is opt-in keywords. So you can take a keyword like Florida did for Hurricane Matthew with FL Prepares, and it works two ways. So on the one hand, you can post out to social media platforms, but it also is an opportunity for people in the community to opt in. So they can text 888-777, text Florida Prepares. It's that first tweet right on the top there, and then you know where they are regionally. You can send them very specific tweets about, shelter in your area, evacuate now, return to your homes, and they will get that information. It can be a very powerful tool for keeping the community informed with accurate information. So we strongly urge you to try our opt-in keywords. Overall, how Everbridge can help you is our entire command center, your entire command center can be run from our platform, as they did here at Seton Medical Center in Austin, Texas. We are mobile, so you can be in the command center or you can be anywhere inside, outside your facility executing the plans. We do work with the community, with first responders in the community. You can have them tapped into your network and everyone can be speaking on secure lines that are very stable, very reliable, 99.9% reliability during emergencies, during all times. And then we also can, the greater community, not just the first responders, but the people in your community. Do you need to address language problems? Do you need to address diversity problems? Is there something that you need to do specifically for maybe 1% of your community? It can be addressed within the Everbridge platform for communications. We do have an extensive CMS, Emergency Preparedness Resource Library. We are updating it all the time. Definitely go there. We have white papers, other webinars on demand, even a quiz to see if you have gaps in your communication plan. It can be very helpful. And we also have the Everbridge General Hospital Test Environment. It's a test environment, so it doesn't go out to the real world, but you can send templates out. You can execute various messages to different groups. You can see exactly how it works and how it can help your hospital or facility. If you do have any questions, please feel free to contact us. You can see my email at the bottom there, lisa.johnson@everbridge.com. You can call in directly at 781-373-9800. We pick up the phone during business hours on that line. And we do believe very much that good communication is good medicine. A lot of the hospitals and healthcare providers in the country agree with us. We currently have over 1,100 hospitals in the U.S., and a little bit more than 23% of all hospital beds are covered by the Everbridge platform. So we invite you to talk to us and see how we can help your facility. That's all for today. Thank you so much for coming. We will be sending out the resources in a day or two. We look forward to seeing you here again.